This program is brought to you by First National Bank of Botswana.
FNB, how can we help you?
Welcome to First Issues. As the COVID-19 outbreak becomes a global epidemic, the corporate world is starting to grapple with its potential impact on human capital as the key factor to productivity, wealth creation, and other facets of economic growth. The fears of losing experienced and highly trained staff as the number of infections and deaths rise every minute globally. Corporates all over the world are asking their teams to work from home in an effort to minimize infection amongst staff members and avoid the spread of the coronavirus. The number of frontline workers testing positive to the virus, in particular health staff, continues to rise steadily. As the virus has no cure, the only available option to them is to go into self-isolation and hope for the best possible outcome: full recovery. At present, free reference website Worldometers reports that there have been almost 500,000 recoveries the world over. First Issues caught up with two of them: Andy Periati, an investigative journalist in Atlanta, the United States of America, and South African blogger and world traveler Naledi Radebe. Both our guests detail their different experiences with the virus.
So I actually don't know how I contracted the virus. I recently traveled to the country of Colombia shortly before testing positive. So travel may have been a part of the diagnoses.
I felt my first symptom on the 15th of March, which was a Sunday. And by the 16th of March, I went for a test.
I first started developing symptoms around March 16th, 17th. I had a very high fever. I had headaches and body aches all over.
The feeling that I had was a tightness of my chest and difficulty breathing.
About halfway through the experience, halfway through the illness, I started coughing a lot. And then I also lost my sense of smell.
You know, you're used to getting a cough, you're used to getting a sore throat, but to feel like you can't breathe is so significant that it made me feel like I needed to get tested.
Maybe at this point you could tell us about your healing process and how you went through the whole experience of it.
I went for my test and I waited for about 8 days because it was so backlogged for my results. But in that space of that 8 days, I stayed indoors in self-isolation to make sure that I didn't kind of contaminate anyone else or spread the virus.
It was 10 full days of a fever that wouldn't let go. That was probably the most frustrating part of the illness, is that I felt hot and I was sweating for 10 days straight, and it was very uncomfortable. I almost went to the hospital 2 times because my fever really spiked to about 103 and wouldn't let go. But ultimately, I stayed at home.
After I got my results, I expected that, you know, I would somehow have to go into some kind of treatment. But my doctor told me very clearly, and it is fact, that there is no cure and there is no vaccine. So what you're expected to do is treat it symptom to symptom basis.
For those people who have tested positive for the coronavirus, COVID-19, take it very seriously and pay attention to your symptoms. If you start having respiratory issues, call your doctor, call the hospital ahead of time to see if they can treat you.
If you feel a cough, you treat that cough. If you've got a sore throat, you take lozenges like how you would normally take lozenges. You know, in terms of tightness, so I had an interesting symptom because it was tightness of my chest and difficulty breathing. It was so hard to, you know, like, what do I do when I'm in a situation like that? So I ended up kind of really using a lot of home remedies that I'd picked up. So just steaming over a bowl of hot water, or using a humidifier or a nebulizer, or even in the shower, just getting steam and trying to clear your airways with Vicks Vapor Rub. A lot of hot drinks to try kind of like warm up the chest. Taking mucolytics like ACC 200 to break down mucus in your respiratory system.
To stay home, stay away from people, and to let people know how you're doing. And don't be afraid to ask people for help. If you need food or you need supplies, the best thing you can do is to self-quarantine at home, stay at home, and try to just get through it by yourself.
Anybody can get it, and I was also very lucky. My symptoms were almost asymptomatic, but it might not be the case for somebody else. And you can be healthy and you can seem likely not to contract it or have heavy symptoms, and turns out that it's going to hit you very hard. So it's really just a matter of taking this seriously and taking care.
I'll end with, please take this virus seriously in Africa. I know that Africa doesn't have a lot of cases compared to the United States, but please take this seriously. Try to stay home as much as possible, away from others, so you can help flatten the curve and keep everyone safe. Wear masks. I'm not wearing one right now because I'm at home. And that's really to protect others, not necessarily to protect yourself. But the more people wearing masks, the more safe everyone will be, because they won't be accidentally putting droplets on you through coughing or sneezing.
Andy and Naledi, thank you so much for affording us your time once again. We truly appreciate it here at First Issues.
When running a business means
Where did I put that receipt?
we can help you with instant accounting, free software that does your bookkeeping for you. When running a business means
Wait, what do you mean the container hasn't arrived?
we help protect your business from risk with Mohwebi Insurance. And when it means
How do we pay our staff that don't have bank accounts?
we help you make multiple payments directly to people's phones with e-wallet bulk send. At FNB, we're constantly innovating to help business owners at every stage of their journey.
You're watching First Issues. The biggest economies of the world have been brought to a standstill. The busiest highways are empty, and the catastrophic consequences of COVID-19 have been felt at every corner of the globe. The world is facing a fast-changing situation with great uncertainty, as the coronavirus, which currently has no cure, has shut down corporates and wiped out informal sector businesses from the streets of all capitals of the world. For now, the only sustainable way to survive this virus is to avoid getting infected. But what sort of lifestyle must one adopt to reduce their chances of getting infected by COVID-19? This is a question we posed to a medical practitioner, Dr. Kiran Bhagat.
One of the commonest questions asked is how, as an individual, can I prepare myself to most effectively prevent or fight this COVID infection besides hand washing, social or physical distancing, and wearing masks. One must remember that this virus has never been seen by the global community prior to its arrival late last year. Therefore, the body's immune system has been unprepared to fight this infection, unlike our annual influenza or flu-like illnesses. Therefore, the herd immunity has not been built up. What we can do as individuals, besides the things we've been talking about on social distancing, hand washing and face masks, is preparing the body. One can do nothing about the virus, but the environment in which the virus attacks can be best prepared by a set of rules that we often talk about. Having understood that the virus is something we have no control over, it is the environment in which the virus sits that we need to modify by appropriately improving our immune system through various mechanisms, including exercise, a dietary approach to boosting the immune system, as well as reducing stress and allowing ourselves to sleep more, as we know that sleep is nature's nurse and boosts the immune system. That the things that depress the immune system are processed foods, particularly high in sugar. We know that sugar is particularly immunosuppressive from a large body of literature that demonstrates this. One simply has to look at what many diabetics succumb to understand the significance of the poisons related to sugar, which are not only found in the sugary foods that we eat, but also in the processed starches that are consumed around the country. We know from current data that the majority of those that succumb fatally to the effects of the coronavirus are those that are elderly and that have chronic diseases. Certainly in Africa, we are not yet prepared in terms of statistics to demonstrate how many people carry chronic disease, but we know in the United States, 6 out of 10 people have chronic diseases such as high blood pressure, diabetes, stroke, and obesity. All of these influence the ability of the virus to spread more rapidly. Now has been one of the greatest and easiest times to form good habits. With social distancing and quarantine, isolation or lockdown, there is much greater ability to emphasize and focus on your health in terms of lifestyle and exercise. Getting enough aerobic exercise, such as 20 minutes daily, whether it's simple walking, jogging, running or skipping, is sufficient to activate various neurohormonal, which means nerve and hormonal changes in the body to improve the immune system to fight infection. Equally, we know that supplementation to the diet, and remember, supplements are to supplement a good diet but not replace a good diet. You cannot replace a bad diet by exercise or by supplementation. But supplements are there because we often cannot afford or have the ability to eat a good portion of fruit and vegetables on a daily basis. The vitamins and minerals that we know improve immune system are particularly studied in China during the corona epidemic last year. And the Chinese have found that large doses of vitamin C, magnesium, zinc, selenium, and vitamin D have been supportive in reducing the effects of the coronavirus. Many of these are already found in fruits, nuts, and vegetables, but taking these as a supplement may also assist.
As almost half of the globe, including Botswana, has gone in extreme social distancing, which is currently a necessary evil to curb the scourge, what are the possible mental effects of long periods of social distancing and isolation?
The effects of isolation historically, such as prisoners in an isolation cell, demonstrates the effects on the brain of extreme social isolation. And today, with lockdown, quarantine, and social distancing, the effects are going to be felt both now as well as traumatically after the events are over. No doubt, the effects of social distancing, quarantine, and lockdown will have an important effect on reducing the spread of the coronavirus. One must also reflect on the possibility of the adverse effects of particularly the elderly living in isolation for several weeks. These are important matters to consider in the long term, whilst we emphasize the lockdown and social distancing to reduce the epidemic that we are faced with. The consequences must be borne and will definitely be seen after this affair has been done and dusted.
When running a business means
Where did I put that receipt?
we can help you with instant accounting, free software that does your bookkeeping for you. When running a business means
Wait, what do you mean the container hasn't arrived?
we help protect your business from risk with Mohwebi Insurance. And when it means
How do we pay our staff that don't have bank accounts?
we help you make multiple payments directly to people's phones with e-wallet bulk send. At FNB, we're constantly innovating to help business owners at every stage of their journey.
Today's children are very conversant with technology, so much that a 3-year-old can navigate through a smartphone, tablet and other gadgets with ease. This technology came with it the social media wave that every child has now become a part of one way or another. Younger children are now into games, while older ones are into your Facebook, Twitter, Instagram, TikTok, YouTube, and many others. The availability of these various social media platforms has become instrumental in being teaching aids for children, especially after school, while also keeping them entertained. However, the repeated use of these can make children have a negative perception of reality due to peer pressure, especially teenagers. We have seen how these can warp a person's attitude towards everyday activities and real-life communication. This presents with it the possibility of being addicted to being on social media sites. While social media addiction can happen to anyone, there's no doubt that children are more prone to developing this problem. While there's nothing inherently bad with interacting with friends online or exchanging photos, but for a lot of children, the line between the virtual world and offline reality can become quite blurred. How then can parents and caregivers ensure that this powerful tool is not to the detriment of their children? Social media enthusiast and managing director at Sturgeon Digital, Obake Ngogwe, explains.
As parents, we obviously have the first responsibility to foster learning and growth and allow for curiosity and give access to those means that allow children to be themselves. And social media, as we all know, is this huge information realm where children could be learning every day. They could be playing every day. They have the opportunity to learn skills like coding, which is being encouraged. So science, technology, engineering, and mathematics. They could be doing all that on social. But at the same time, social is this huge world where you're connected to people not just here, not just to your own parents, but once you go and log on online, now you all of a sudden are part of this 3 billion strong digital community. And that comes with its dangers. So unfortunately, in this very same world that they have the opportunity to grow and learn in, there is the dark side of it, of the internet, where as soon as they tap into this global village, they get exposed to predators, to people that are looking to exploit and lure them into networks where they could end up being trafficked. You don't want to socialize your child in a manner that says you are the authority with regards to who they are and what they get to do, but you obviously want to allow them their liberties and still know and trust that what you're teaching them is something that enables them to be a fully functioning member of society tomorrow and not someone that's withdrawn, because those are some of the downsides of it really. The more they spend time on social media or gaming, because some kids could game for like 6 hours in a day. And then tomorrow you go as a family to an outing, you're trying to interact with the neighbors and they're just like, I just want to go home. And already that speaks to some, I don't want to call it dysfunction because we're different as people. Some people are more withdrawn than others. We do prefer to be who we are. And so as parents, I think you try to do the best that you can do. There is no one right answer, but I'd encourage and urge all of them to spend as much time doing the physical stuff and even talking about the things that maybe kids experience on social, just so that you're part of that conversation and you're part of that world. At least you're helping guide them or even influencing what it is that they want to consume on digital, yeah.
But Obakeng, what age is it okay for children to be on social media, and what should social media be used for at different stages of a child's development?
I've been fortunate to work with social media from early on. And one of the things that I observed is the social media platforms themselves try to prescribe the ages. For example, on Facebook, you cannot join Facebook if you're under 13. And I don't know if that's to say that at 12 or 13, you're mature enough to start interacting with older people. But I think depending on the kind of relationship you have with your children and the kind of trust you've built, you could introduce them to the more kid-friendly apps from earlier on. I think maybe 7 or 8, they could go into kid-only apps where maybe it's more about education, which is a lot of the activity that would be happening on that social platform, or just socializing and learning social skills, because fortunately that's exactly what it is that you're trying to teach them at that particular age. So whatever decision you make as a parent in terms of allowing them access to social should be aligned to the principles and values that you have and that you're trying to instill and empower them with. My child is already using my phone. I think I've already alluded to the fact that they use the kids mode, which allows them to play kids-friendly games, which they can even play online, which is social media in itself. And at 5, I think it's kind of safe. I don't want to stoke the curiosity or the curious fire that they have, because, you know, unfortunately or fortunately, in my age, being young and playing socially meant playing. But for them, technology is here, it's the current, and we can't be in denial.
Before we part, let us be encouraged to practice impeccable hygiene habits during this wave of the coronavirus epidemic. Wash your hands for at least 20 seconds and disinfect all surface areas in your homes, workplaces, and any other places frequently. Reduce unnecessary travels and contact. With that, we have come to the end of our program. Until next week, keep safe and have a pleasant evening. Good night.
This program was brought to you by First National Bank of Botswana.
FNB, how can we help you?